Hey, good evening, everyone. Hope everyone is fine. So, now we are moving on to the next step. And in part one, we gave the legal map, how ART Act 2021 and Surrogacy Act, and how National Registry framework is there. And what we want to move to the in this session is to take you inside the clinic. And there are so many uncomfortable truths. There's recently the Art Act represents a genuine step forward for a sector that's operated without binding rules for too long. What matters now is whether India has the institutional will to refine it, to replace box ticking compliance with outcome driven accountability. So, this was said by expert panel concessions Indian Art Law Review 2026. Today, I'm going to walk you through five compliance pillars that separate a clinic that merely has a registration certificate from a clinic that has generally achieved the gold standard. One, documentation and audit readiness. So there is certain set of document which needs to be complied and which needs to be kept as per the ART Act, as per the Surrogacy Act. Second, staff qualification and training. So everyone in the clinic should be should have particular set of degree, should have particular set of experience to work as per the ART Act. Now, then comes donor anonymity and DPDP. So earlier there was a restriction on the. Can I switch off my? I'm going to switch off my video and keep going with the audio part. So there was donor anonymity that was required earlier. Now there it is still there, but at times when parents, the intending parents, are bringing in their own donor, their known donor, then it has to be routed through the ART bank only. Now comes the fourth embryo chain of custody. So it is more of the clinical part, but a good SOP should be in place where uh, so that the quality of embryos do not degrade. A good technician should be there. Basically, all these things. So, what does an audit-ready clinic look like? Every patient file has a complete, signed, informed consent before any procedure begins. All donor agreements are on record, age verification, medical screening results, and one-time donation declaration. So, once a donor can only donate once in their lifetime, and the act has done, and the um, just give me a minute, please. There should be insurance coverage for each oocyte donor in the file. Insurance is mandatory under Section 22 of the Act. Standard operating procedures are well written, current, and signed off by the medical director. There's a functioning grievance cell as well with record complaints and resolutions. The inspecting authority, your state board or national board, can walk in without prior notice. Until under Rule 10, surprise inspections are expressly permitted. Your documentation must be inspection ready every single day, not just during registration week. So, maintenance of record is very important under this act. And this act has also penalized non maintenance. A clinic that builds these systems properly rarely has to worry about inspections because the system itself becomes your defense. The Art Rule 2022 are remarkably specific. What can do, who can do what inside your clinic. This isn't a soft guideline, it is a regulatory teeth. So once we are in the art rules 2022, it has given clear guidelines. It has given clear guidelines in schedule part 1, rule 4, ART level 1, how many minimum one gynecologist is required. Staff of shall have ART level 2 clinic staff. Level 2 shall have minimum one gynecologist, one anesthetist, one embryologist, one counselor. The additional staff at the level of director and embryologist must be employed uh, by the ART level 2 clinics. So a gynecologist should have at least 50 OM pickups done before being able to work at the clinic. She should have or she should have postgraduate in gynecology and obstetrics with super specialist director of medicine or fellowship in reproductive medicine and experience of not less than 3 years of working in art clinic. So at least she should have 3 years of experience. The andrologist should be well qualified. He should have DNB in urology or MS general surgery, minimum 2 years of experience in reproductive medicine. Embryologist shall have at least uh, 500 lab procedures. At least 500 lab procedures. So nowadays, wherever we have these registrations going on, so the at most of the in most of these states, the clinic has to provide the record of all those 500 procedures done by the embryologist or by gynecologist or whoever they are employing. Formal training logs, uh, maintaining of logs is also very important in the embryology lab. Uh, Good laboratory practice guidelines as defined internationally. This is non-negotiable for level 2 clinics. My practical advice is to designate one person in a clinic as your compliance coordinator. Their sole job is to ensure staff files, training logs, and SOPs are always correct. It is far cheaper than a show cause notice. A person responsible shall bear full responsibility to ensure that the staff of the registered unit is adequately qualified, that proper equipment is used, that genetic material is disposed of properly, and that the center fulfills the conditions of its registration. So, this is what ICMR guidelines used to say earlier. Now, let's come to donor anonymity and DPDP guidelines. This is the area where I would be spending a little extra time because it sits at the intersection of two laws that most clinics are only beginning to reconcile. The ART Act mandates strict donor anonymity. The identity of the donor is not to be disclosed to the recipient. The donor relinquishes all parental rights. This is the core ethical principle of the framework. At the same time, the Digital DPDP Act, that is Digital Personal Data Protection Act, which we call DPDP, has fundamentally changed how your clinic must handle digital data. And art clinics are sitting on some of the most sensitive data imaginable. Under the DPDP Act, your clinic is a data fiduciary. What does that mean? It means you are legally responsible for every piece of digital personal data you collect, from patient phone numbers and ABHA records to embryo storage logs and donor profiles. At present, the ART Act is well supported by the DPDP Act. However, further, judicial and legislative deliberations are required to effectively regulate and balance the interest of all stakeholders. Here's where clients are making dangerous mistakes now. Sharing patient reports or donor matching information over WhatsApp without explicit, informed, documented consent is a liability under DPDP Act. Penalties can reach up to 250 crore for serious violations. Using clinical data for making communications without separate consent. For example, sending IVF success story testimonials to patients who never consented to promotional use of their data. No data retention policy. The DPDP Act requires you to delete personal data once its purpose is served, but the ART Act requires you to keep records for 25 years. These two obligations must be reconciled in a written policy. So, under ART Act, the retention of data should be for IVF patients, it should be for 10 years, whereas for surrogacy patients, it should be for 25 years. The patient data privacy mistakes that close down clinics are really dramatic. They are quite daily and shrugged off as routine until they are not. With DPDP Act 2023 and DPDP Rules 2025 setting the rules of the game, Indian clinics are no longer afford to treat privacy as a legal afterthought. So this is what some of the leaders in data privacy have said about it. The solution is what I call doer compliance data policy, a single document that addresses both the ART Act long term record keeping mandates and the DPDP Act's privacy and consent obligations. Every art clinic in India needs one of these. And remember, when it comes to National Registry database, your clinic data submission must be handled with the same rigor. Data breaches at national registry level are a real risk. And your clinic's internal hygiene is your first line of defense. So I would not be speaking much on embryo chain of custody protocols because this is something that the next speaker would be covering. Now, let's come to inspection preparedness and quality benchmarks. Your registration certificate for ART level 2 clinic is for 5 years. It must be displayed prominently in your clinic, but registration is a starting point, not a finishing line. The state board, the national board, the national registry all have the power to inspect your premises with or without notice. In my experience advising clinics, the ones who sail through inspections share three qualities. They do internal audits monthly. Their MRD files are inspected themselves on a monthly basis. They do not wait for someone from the uh, DMHO, someone from the CDMO office, someone from the a nodal office of PNDT, you know, to come to their clinic and knock on their doors, and then they would do something. They keep doing it themselves. This is they inspected themselves first. Their staff is well trained and they know the compliance framework. Not just the doctors, the staff. One designated person has to know it. They should know what forms are to be taken on record, what consent is to be taken on record. There are limited number of consents in the ART Act 2021 and ART Rules 2022. So if you are as a medical legal advisor, I always say a consent is your line of defense. Always communicating them about the procedure, its pros, its cons, is your first line of defense, and it should be taken in writing. Third is what we say is you have a legal counsel on retainer, not just for crisis management, but for proactive guidance as the law evolves. So this is where I'm promoting myself and my services. On quality benchmarks for clinics seeking accreditation beyond basic regulation, organizations like QIS set internationally benchmark standards. My co speaker will delve deeper into the accreditation thing later. But from the legal compliance side, accreditation is increasingly what sophisticated patients, insurers, and hospital networks look for. It is your competitive differentiator. We are an evolving society. The law is good, but it needs tweaking. Dialogue with the government is essential. So I always say that whoever, when you have the mail ID of the national board, whenever you feel that, because the national board has certain set of standards, and their limit, their experience is limited. Whereas the practitioner, the clinicians, the embryologist, you are facing a new patient every day. More than a new patient, you're facing multiple patients every day. The there there can be a time when you are facing a situation which you have never felt, which you have never faced before. So I always say that if you're facing anything, or if there's something new, it should be informed to the national board as well, that this is something away from the act. Moving on, uh, let's practical tip that I hand over. If your clinic has ever received a notice from the appropriate authority or had an application rejected, suspended, the AITI gives you a structured appeal pathway. You can appeal to the state government and union territories or the central government. The AITI gives you structural pathway uh, for the grievance redressal. You can always pursue it in court, but it is better that we always comply with the comply with the structure, with the infrastructure, as per the ART guidelines. Now, a true compliant clinic is not just checking boxes on a government form, it is building a culture of accountability, one that protects your patient, protects your team, protects your clinic, protects your institution you have built. Today, any clinic can claim um, 80% success rate. Patients have no reliable way of verifying those claims. The only thing that stands between a patient and an unscrupulous operator is a robust regulatory framework and a clinic that actually lives by it. So, actually, what happens is, uh, we always see, exaggerated claims everywhere. What but recently, I have seen in Rajasthan that the appropriate authorities giving show cause notices, always asking for the data, the success data, success rates, and everything. Now, just my line, the last line that I want to speak is, the gold standard is not a certificate, it is a practice. So you make you make a practice within your practice that everything, every compliance, every consent form, everything is done on time every day. A person is there to make sure that each and every document, each and every procedure is documented. Consent is taken from the patient, donor, everyone. I will just pass on the dice to the next speaker.
Yeah. Thank you so much, sir. Thank you so much for this insightful session. So, moving forward, I hope my screen is visible to all.
Yes,
Yeah, so good evening, everyone. My name is Shani Royala. I'm an accreditation officer at QEICHSC, which is currently handling the accreditation program for art IVF centers. And it's a privilege to address this webinar. Now, Quality and Accreditation Institute, through its Center for Accreditation of Health and Social Care, has been at the forefront of building structured art care ecosystems in India. With dedicated program for AIT IVF, accreditation provides a framework that converts the intent into implementation. Because accreditation is not merely just a certificate. It's a validation of clinical excellence, a driver for continuous quality improvement, a mechanism for standardization and benchmarking, and a signal of trust of patients and stakeholders. So, moving forward with the session, Duke chain of custody, ensuring accuracy, traceability, and patient safety in IVF. Why it matters? To prevent the gamete embryo mix-ups, that is one of the most serious IVF errors that ensures legal and ethical compliances, and also builds patient trust and confidence. It is required for accreditations and regulatory approvals as well. Under IVF accreditation programs by QAI, we help the accredited organizations prevent such mistakes because there is a unique patient identification protocol, there are laboratory safety and traceabilities, there are risk management systems, there are non-compliances. If there are non-compliances that can be lead to major non-conformities, these can be prevented by an organization that is accredited. Now, the key elements to a robust CUC system, there is a unique identification number that is given to each patient. This in which there is a patient name, the ID is given that can be either barcode or QR code. They are applied consistently on all the consumable items that can be the dishwares, tubes, and straws. There is a double witnessing system by two trained staff at every critical step, or electronic witness system. The traceability is unique. That is the ability to track every embryo from the origin to the current status and the final outcome. The documentation is robust. There's time-stamp records on each and every document. There are staff signatures, there are electronic logs, and there are audit trails that is done in between to check uh, and there is segregation and labeling. There are clear labelings to avoid any mix-ups, physical separation in lab workflow wherever possible, and there are prevention systems, there are checklists, there are SOPs, there are alerts in electronic systems, and incident report mechanism. Now, each and everything that is mentioned over here is uniquely covered in a ART IVF second edition standards. And talking more about the program, what the gold standard actually looks like. So QAI, an internationally and globally recognized accreditation body, accredited by ISQA, started its operations in August 2017 and is the fastest developing accreditation body in the world. We have developed over 21 standards in 8 years. There are 4 verticals: Center for Education and Training, Center for Accreditation of Health and Social Care, Center for International Accreditation, Center for Accreditation of Veterinary Facilities. Presently, we are at Center for Accreditation of Health and Social Care, CHSC. Talking more about our programs, not only just ART IVF, we have over 21 programs and many more in the upcoming stage. MBTF, headache clinics, these all are in the developing stage. Talking about the international recognitions, because in ISQA, in QAI is the first accreditation body in India to achieve ISQA accreditation in less than 5 years of operations and is also recognized by the Ministry of Health, Central Government Health Scheme CGHS for private empanelment of private hospitals, eye centers, dental centers, and imaging centers. Accredited organizations have this unique mark of sustained quality to ensure that the quality is top notch. Now, the question arises, why should an art center sign up? Because it enables the facility in demonstrating commitment to quality and safe patient care, or just uh, demonstrating the transparency in practices. Now, ART centers that are accredited demonstrate the facility functions in an ethical manner. There is enhanced confidence in the services. There is compliance with the government guidelines and regulations. There are possible mechanisms to safeguard from any potential legal liabilities as well. The accreditation process of that QAI organization offers stimulates the continuous improvement in the service delivery. There is a documentation and standardization that helps increase the operational efficacy. The display of the QAI mark of excellence conveys the center's commitment to quality, safety, privacy, confidentiality, and uniform care that Sir has previously explained in his PPT. Also, there is support in medical value travel, medical tourism business. There is a mechanism of self-regulation also. Now, what are the benefits that an QAI ART accredited organizations get? There are clinical and patient-centric benefits. That is, there is structure quality standards. There's improved clinical outcomes because there is adherence to international best practices, there is reduced complications and enhancing the success rate of the organizations. There is patient safety and trust because the standards are emphasizing on the infection control, laboratory quality, transparent communication, reassuring patients about ethical and safe facility fertility care. There is ethical practices because accreditation requires compliance with the ART law and guidelines and protecting the patients from malpractices and ensuring informed consents. For ART centers that are accredited, accreditation stimulates continuous improvement. The insurance incentives, their capacity building because we offer training programs, our internal audit training program conducted by CET department and awareness programs conducted by CHSC departments to build in-house expertise and prepare centers for the ongoing compliances. And there is a global credibility as the standards are developed using ISCO principles that aligns with the ARD centers with international benchmarks. Also, for the ART centers, there is a reduced wastage, there is a transparent operations, and there is opportunity for healthcare facilities to benchmark. And there is less staff retention rate and increased business both for national and international medical travel. Talking about some broader impacts, there is public confidence as accreditation signals transparency and reliability, strengthening patient trust in fertility services. There's continuous improvement as centers go a periodic surveillance assessment, reassessment, and there is a system of continuous monitoring and improvement. As talking about the professional development of the accredited organizations, there is a collaboration of gynecologists, embryologists, and administrators, and everyone has their clear defined roles. Now, just a comparative table. A non-accredited organization, the clinical protocols are often variable, they are unstandardized, but for us, it's evidence-based and internationally benchmark. Patient safety in a non-accredited one is a limited check, but because it's an accredited organization, there is mandatory infection control, lab safety, ethical compliance if we are talking about, it may vary. But for an accredited one, there is strict adherence to the ART laws and applicable national and international guidelines, which are clearly stated in our standards. Talking about the insurance empanelment, sometimes it is difficult for the non-accredited organizations to get insurance empanelment, but because the organization is nationally and internationally accepted, it's recognized by CHHS and insurance. Now, talking about the global recognition, we have ISCO aligned standards. In terms of continuous improvement, we have structure audit, surveillance, and reassessment. Now, for the staff, there is increased staff satisfaction as we provide the opportunities for continuous. Accredited organization provide the opportunities for continuous learning. There is a good working environment. There are leaderships and ownership of the process. There's increased staff safety, increased confidence through QMS, and there are professional developments. A third party, it provides an objective system of evaluation and empanelment by third parties and helps in reliable and documented information on facility, infrastructure, services, and level of care. Now, just a brief introduction about the framework of standards. Second edition standards that were launched in November 2024 has 10 chapters, 100 standards, and 543 criteria. The first 5 chapters talk mostly about the continuous quality improvement and the managerial indicators, while the last 4 focus on patient safety. Talking about the standard and criteria, the standard is a statement that defines structure and process that can be substantially in place of an organization to enhance the quality of the care, while the criterion is a measurable component of the standards. And the acceptable compliance with the criteria determines the overall compliance with the standard. Now, just every 10 chapters, I'm just giving a brief summary for each and every chapter of it. Talking about the first, governance and leadership. in our standards. The chapter talks about that the center requires a governance structure that is ultimately responsible for the quality and safety of services provided, and this responsibility is derived from its legal identity and operational authority for all the activities undertaken by the center within the ambit of applicable laws and regulations. And each center, regardless of its complexity, has a formal structures. The leaders ensure that a system exists that promotes safety and quality, and there is a provision of services that meets the need of patients, availability of adequate resources, that is human, financial, physical, and monitoring evaluation of improvement activities. Now, the human resource management chapter talks about the people that work in it or for the centers, and they are integral to ensure the delivery of quality, patient centered, and safe care. And the center must be able to assure that the public or patients that it can meet their needs and deliver quality and safe care through a team of dedicated and qualified staff. They the support also includes a management team that provides a safe physical environment for the staff to work in and which is free from harassment or accidents. The next chapter, facility and risk management, talks about the center preventing the people uh, to receive unsafe care and treatment and prevent any unavoidable harm or the risk of harm. The practices are safe, high quality care is being provided, and it is also linked to how the resources are being used, how they are planned, how they are managed, how they are delivered. The center must assess the risk to the patient's health and safety during any care and the treatment, and also to make sure that the staff are competent, having experience to keep the patient safe. The premises and equipment must be safe and available in sufficient quantities, and there are good clinical and good laboratory practices being followed in all the operations. Information management system talks about the being an information, system having the information for the center, and enough adequate information is available. The system should capture all the transmit, store, analyze, and utilize and retrieve the information whenever required, and improving the clinical outcomes as well as for the individual and overall performance of the center. The information can be in paper form, electronic form, or mix of both. Now, the continuous quality improvement talks about the center recognizing the safety of the patient. Because it's of the paramount importance, a center is focused on quality improvement. It looks for ways to promote patient safety and quality of care. And the center also ensures that there are regular evaluations of programs, of performance indicators, there are benchmarks to identify the positive outcomes and areas for improvement. Any necessary actions to improve the quality and safety of the services are implemented, and learning is dissemination, both internally and externally. Patient assessment and care talks about patients are made aware of the services that are being offered. Process is defined. Registration for all activities, including registration, admission, referral, and discharge. And patient once taken to the facility, either as an outpatient or an inpatient, are assessed and reassessed as per the policies. PRE talks about patient in the center being taken care of. It is important that the patient rights are documented and known to the patients, provide education to the patients for the care, and better patient satisfaction or outcome is achieved. MMS talks about the purpose of medication management. To provide a framework for safe and effective medication management system, there is a safe and effective medication management, which includes the process for procurement, storage, prescribing, transcribing, preparing, dispensing, and administration of medications. And all these comply with the rules and regulations of the law of the land. Now, surgical safety talks about the center having adequate facility and knowledge to carry out various procedures that are correct and based on evidences as far as possible. The different policies and procedures are required and to be in place to ensure that the procedures are being provided, desired outcomes, and the care is safe. And the surgical process adhere to the best practice for the use of anesthesia. The last chapter, hygiene and infection control, that talks about the changing technologies and disease profile continue to present new challenges for the infection prevention control within the healthcare facilities. When the patients are at risk, the healthcare facilities take immediate actions for it and prevent the potential route of infection, the transmission of disease-resistant bacteria among the center population, and poor infection control practices. So this is one of the most common complications within affecting the healthcare patients. So our chapters cover all these aspects. Now, talking about our clients who are accredited and how the topic was how the accredited organizations really look like. So we have over 53 centers from Indra IVF being a major client, with Vadia Hospital, Apollo Fertility, Oasis Centers, Mehta Hospital, Nova IVF, and Motherhood Hospitals being a prominent clients. So thank you so much for attending this webinar. For any queries regarding the process of accreditation or any query from the part that Divyanshu sir has covered, please feel free to raise your queries. Thank you so much.
So, Senthamil Selvan Chelia, Dr. C. Senthamil Selvan had asked me a question. During the inspection, are we required to provide hard copies of the documents or a digital data safe copy is considered to be sufficient, sir? Both can work, but it is advisable that you have the hard copies with you. Okay, thank you. Ma'am, do we have any other questions?
We have one from Nibhash sir in the chat box. He's asking that for the donor traceability in
Okay.
India, yeah,
Hmm.
sometimes
So,
the donor,
the
sorry,
it
please go ahead.
is a utopian thought that we should have something like that, and I am sure national board is working on it. But that is one of the biggest problems, that donor is donating here and there everywhere wherever they can find the opportunity. So that is a must thing to do right now, but at present it is not available. We might have it when the national registry enforce it, that every center should have information, and every center should be should be given a software or something like that, then only it can be done. Okay.
So the next question
Thank you.
from Sinthamil sir. Yeah, sorry.
I have
Just
addressed it.
yeah, you have done it. Okay.
Oh no, there's a
Yeah, during the inspection, are we required to provide hard copies of the documents or the digital data is considered sufficient?
planning generation transition wishes to seen before treatment can proceed.
So we at QA actually do prefer that we just get the soft copy of the data. No hard copies is required.
Nibhashji, your second question, what you're asking is, it can be done in in some circumstances only. There is no additional consent as of now, and there is no clarity on what you are asking. There is no additional consent or documentation at that moment. So only the semen freezing form should be signed. Rest, if anything happens later on, I would state that it should be sent to the either board or the court for clarification, because there is nothing as such uh, which speaks on the gender change and everything. Even this act does not cover the LGBTQ community as well. So there is no clarity on it, sir. Charges can be, Dr. Richa ma'am, charges can be displayed. So there's nothing wrong with it.
So any law for disaster management if anything happens, and how will it handle for the IVF center?
I didn't get you, ma'am.
Yeah, Dr. Kalyani Bari is asking that is there any law for disaster management, and if anything happens, how it will be handled for the IVF center?
Disaster management is a different thing, but now I'm getting where you're going. That if anything happens to the sperm or cryopreserved
Cryocans, yeah.
cryocans, there's no law as such. It can only be handled through the uh, ART Act only at present.
So I think we are done with the questions, sir. Yeah, thank you so much, everyone.
We have one group photograph. I request everyone to please switch on the camera. Please comfortable. So we can have one group photograph. Are you ready? Please look into the camera and smile. Thank you. Thank you, everyone. Thank you, Devanshu, for your wonderful session. And thanks to the friends. Thank you.
Thank you, everyone.